Do you trust AI in healthcare? And then in the health area, this is interesting. We've been reporting on different AI stories in the health sector, in our newsletter every week. But this is interesting because where they're not seeing like a financial ROI, they are seeing a huge, well, I don't know about huge, but they are seeing an uptick in operations and satisfaction metrics. So there are things immediately. And like we suggest with all of our implementation, start with the things that take the most time, start with the things that have the bottlenecks. And so bed management and documentations are the two areas that they're already seeing ROI in, and not necessarily, or they may or may not be seeing in the financial area, but like they aren't able to track that yet. But what they are able to see immediately is that AI is helping them in the areas of documentation and bed management, which is great. That makes it a better experience for the patients. And then I'm sure relieves some stress on admin and some of the people at the hospital level too. And then we asked some interesting questions. Do you trust AI in healthcare? Would you like an AI doctor? For me personally, I've used AI in my own medical, and again, you always have to think about your settings, security, all of those things, and the information you're putting into AI. But I've done things recently, like taking blood results, putting it into chat or other tool, and asking for insights based on those. I think the important thing to note here is that AI can help these doctors. No doctor, no person knows everything. And if they can have these tools helping them, wouldn't you want a doctor that is enabled with additional information versus a doctor that is not? So that's the way I look at it. It's a question to ask yourself, but a question everybody should be asking themselves because this is starting to appear everywhere, no matter what kind of insurance or healthcare you have.